Carbamazepine is an anti-seizure medication that also can be helpful in treating bipolar disorder and aggressiveness in people. This medication was initially approved in the United States in 1968 for trigeminal neuralgia. That's a condition that can involve a lot of facial pain around the region of the trigeminal nerve. And then later in 1974, it was approved for seizures. Carbamazepine is similar to oxcarbazepine, which is also known as trileptal, which can also be used to treat bipolar disorder. The medication is best absorbed when taken with food, and it can take up to 2 to 4 days to notice a therapeutic effect from taking the medication. This medication activates the liver cytochrome P450 enzymes, and this can be activated at a maximum level about 3 to 5 weeks after taking the medication. So the cytochrome P450 enzymes are enzymes in the liver that play an essential and important function in metabolizing and making medications and drugs effective. It also is important for cleaning out some toxins, breaking down chemicals that go in that biochemical processes that occur naturally in the body. So in other words, activating the cytochrome P450 enzymes can make medications get destroyed more rapidly, and so you may have to increase the dose of certain medications when taking carbamazepine, including carbamazepine itself. But carbamazepine may be a good option in people who are not responding to lithium or Depakote and need treatment of their bipolar or manic episodes, or tend to be aggressive. So people who take the medication are less likely to have relapses and manic episodes while on the medications. So as mentioned, it can help with aggression in either the children or the elderly. It can also help with aggression in people who are suffering from post-traumatic stress disorder, even other psychiatric conditions like schizoaffective, even schizophrenia. Sometimes those patients can get aggressive, and this could be a good option in those cases. So people taking this medication should be aware that if they have a fever, sore throat, they get a rash, bruising, or bleeding easily, then they should really seek medical attention urgently. This medication can damage the bone marrow. It doesn't happen often, but it can happen. And when it damages the bone marrow, it could destroy the immune cells, it could destroy the blood cells, it could even destroy the cells involved with blood clotting. And so it's really important to get this checked out. You may need to stop the medication if any of that occurs. It really can be identified through a simple blood test. So as I mentioned, this medication can interact quite a bit with the liver, and so there is at times that the liver can get inflamed when taking this medication. Also, about 10 to 15% of people who are on this medication develop a rash, and that rash will go away when this medication is stopped. So here's a chart about many different types of possible drug interactions with carbamazepine. It can also decrease the blood concentrations of oral contraceptives. So this could cause breakthrough bleeding, or it can decrease the effectiveness of the oral contraceptive working, and so therefore it can increase the chance of pregnancy. So the starting dose of this medication depends on what's going on. And someone who's feeling depressed or has a normal mood, then you can start at 200 milligrams at bedtime and slowly go up as tolerated or as necessary. But people who are in a manic phase, you can treat it more aggressively. Typically, you want to go for 600 to 800 milligrams a day, and you could divide that into different times of the day, like morning and afternoon, or morning, afternoon, and night, or so forth. So again, slightly higher doses may be needed after 2 to 3 weeks on the medication, because this medication can activate the cytochrome P450 enzymes in the liver, and so that can actually lead to its own sort of destruction of the medication, so you may have to go up on it a little bit.